Families, our Committee on Families, Seniors, and Health. Mr. Secretary, please call the roll.
Senator Bratton. Senator Carter.
Here.
Senator Nicola.
Here.
Senator Hudson. Senator Lewis.
Here.
Senator Nuremberg. Quorum is not established yet.
Quorum is not established yet, but we're going to go ahead and move on and have some bills heard. So we're going to begin with Senate Bill 841 with Senator Bernskoetter. Just begin when you're ready. This is a bill that was similar to what was heard last year. Is that correct, Senator? All right. Begin when you're ready.
Thank you, Senator Carter. Members of the committee, like Senator Carter said, this is Senate Bill 841 that nearly made it across the finish line last year. It's a health care bill that has many health care provisions from many different places. There's many experts here behind me that would be happy to answer questions, or we can go through each provision if you all would like. But so I don't waste your time, I'm not going to go through every provision that's in the bill, but if you have any questions, my chief of staff has it all tabbed out here, so I'd be happy to answer any questions.
Do you have, is that something that you could get the rest of the committee, just that, so they have that?
Did what now?
Just get that to the rest of the committee, maybe, so as they review it,
Does
they
the rest of the
have
committee
it?
get it?
That'd be
Yeah,
great.
they do.
Okay, yeah. If there's any questions for the senator? Seeing none, appreciate your time. How many people are here to testify in favor? How many are here to testify in opposition? How many are here to testify for informational purposes? Okay, we're going to limit time to 2 minutes each, and we'll begin with our first witness in favor. We timed that just as you were sitting.
Never needed to see it, I guess. I got to get my kind of thoughts together here real quick. So, Madam Chair, members of the committee, Organ Schlam on behalf of Missouri Primary Care Association, Centurion, and Missouri Assisted Living Association. There's 3 provisions in the bill that I want to briefly touch on. First of all, there's a provision in here on 340B. I know 340B has been kind of a hot topic over the last couple weeks. I want to make a couple notes about this one. First, this bill, in order for us to minimize the controversy on this provision, I worked with many of the insurers over the last couple interims. This provision does not include hospitals. It is FQHCs, it is the dialysis clinics, it is the Ryan White clinics, it's the hemophiliac clinics, it's simply those clinics. And what it ensures is that when the 340B discount is given to those entities, that the savings on that money actually go to those entities as the federal law intended, and that the insurance companies, when reimbursing on claims, don't artificially lower the reimbursement and then capture that savings for themselves instead of going to the entity to serve the people that it serves. So that's number one. Number two, Missouri Assisted Living Association, and by the way, Madam Chair, can I put all 3 organizations on one form, or do I need 3 different forms? Yeah, okay, fine.
Well, go ahead, sorry.
Yeah, Missouri Assisted Living Association, there's a provision in the bill that allows for, what used to happen is for diabetes, insulin really was the only treatment, and now that there's so many other drugs, the Assisted Living Association has a lot of people in their facilities that have diabetes, and they want to be able to use these new drugs in the facility, and so they can administer those. It's just the statute's old. The statute was done in the 70s for insulin. We've had new medications, and those new medications can now be administered to those folks who need insulin treatment in the facility. And finally, Centurion, this is a law that allows for dentists to be employed by them to go into correctional facilities only and serve that population. Thank you.
All right, thank you for your time. Any questions for the witness? Seeing none. You're
Thank you.
free to go. We're going to, next in favor.
Madam Chair, members of the committee, Nikki Strong here on behalf of a couple different items in the bill. First of all, the Sudafed language in here, you guys heard this bill, Senate Bill 1069, just a couple weeks ago. This is the identical language that's in here. As a reminder, this is the piece that changes the annual limits from 43.2 grams to 61.2 grams, which would give approximately 8.5 months instead of 6 months of relief to allergy and cold sufferers, still well below the annual limit of 109 grams. speaking on behalf of Haleon for that. Then Missouri Healthcare Association is in support of the administration of meds that Jorgen just spoke about in long-term care facilities, allowing the subcutaneous injections. And then finally, the inspections of long-term care facilities. This is a piece that's limited to assisted living facilities. You guys heard this bill last year. This is agreed upon language, I think, with Senator Lewis, that basically allows assisted living facilities only. This does not include skilled nursing facilities who have received the accreditation of the Joint Commission, which is a very difficult accreditation to get. Allows the Joint Commission to do annual surveys instead of the state, unless there is a facility that has been cited for deficiencies, then it would turn back over to the state. That does not alleviate the state from complaint investigations or any other type of investigations like that. I'm not aware of very many facilities who have received the Joint Commission accreditation because it is a very difficult accreditation to receive or to get. And with that, I'd be happy to answer any questions.
All right, any questions for the witness? Go ahead, Senator Lewis.
I just want to comment on the nursing home inspections, that it is verified that it's the agreed upon language that we worked on last year together.
Yes.
Yeah. And
Yep.
that, I think that we don't want to, we want to protect our most vulnerable people.
Yeah.
And I think the language that we worked on that's reflective in this bill doesn't hurt our seniors or anything. It's just,
Agreed.
so anyway, just wanted to point out that I was in opposition. We worked on it, and thanks for including it here.
Thank you.
Any other questions for the witness? Seeing none, we're free to go. Next in favor?
Madam Chair, members of the committee, Sarah Schlemer here on behalf of the Missouri Public Health Institute, the American College of Obstetricians and Gynecologists, the Missouri College of Emergency Physicians, and the Missouri Society of Anesthesiologists on a couple of provisions. One is codifying the dual language so that they can receive reimbursement through Medicaid. The second one is the provision that talks about the Department of Health and Senior Services being able to contract with a third party to administer federal grants that deal with public health services. The third is the workplace violence prevention language for the emergency physicians. This is a widespread issue that in emergency rooms as well as labor and delivery rooms, we're seeing increased instances of violence against healthcare practitioners, and so trying to take steps to prevent that from happening. The fourth provision is the insurance coverage for anesthesia services. This is preventing the re-proposal of time limit reimbursement for anesthesia services. I know, Senator Lewis, you have a bill that deals with this, and we very much appreciate you bringing that forward as well. And then the fifth one is prior authorization reforms that are contained in this bill, and so all of the healthcare providers would like to go on record in support of that as well. Happy to take any questions.
Thank you. Any questions for the witness? Senator Lewis?
Good morning.
Good morning.
So we had an email exchange with about the anesthesia and just adding a little bit of language of and modifying units. I spoke with the bill sponsor about this yesterday. Just want to go on the record that you're okay with that.
Yeah,
just
absolutely.
making sure all anesthesia services are covered.
Yep,
Okay.
definitely. Thank you.
Thank you.
All right, any other questions? Seeing none, appreciate your time.
Thank you.
Next in favor?
Madam Chair, members of the committee, Justin Alferman representing SSM Health. We would like to go on record in support of the legislation, specifically the prior authorization and sections 191 and 334 relating to telehealth modernization and accessibility. Be happy to answer any questions.
Do you have any questions for the witness? Okay, none.
Thank you.
Appreciate your time. Next in favor?
Good morning. My name is Anna Dale. I'm a pharmacist at Katy Trail Community Health Center. I'm also a patient advocate. I've been practicing for over 10 years. I'm here in support of Senate Bill 841, Section 376.417. The language directly aligns with the intent of the 340B discount program. This program was designated to allow safety net providers to stretch scarce federal resources to vulnerable communities. The program's language does not require health entities to pass on savings to patients. It was intentionally left flexible to meet the varying needs of each organization. Many organizations like ours continue to pass on savings. Just as a preview, our organization in 2025 alone passed on $1.8 million in savings to patients through discounted medications. Manufacturers voluntarily participate in this program in exchange for having their medications covered by Medicaid and Medicare programs. They provide discounted medications to, sorry about that. In exchange for having their medications covered on Medicare and Medicaid, manufacturers pass on the discounted medication prices to safety net designated organizations. The 340B statute identifies the stakeholders as manufacturers, HRSA, and covered entities. Pharmacy benefit managers are not defined as one of the stakeholders. PBM practices have contributed to the closure of many independent pharmacies, particularly in the rural areas where I live. And often the pharmacies that survive rely on partnerships with local health entities like ours through the 340B programs and as contract pharmacies. I urge you to support Senate Bill 841 to strengthen access to care and help make America healthy. Do you have any questions that I can help answer?
Have any questions? Seeing none, appreciate
Thank
your time.
Thank you.
Madam Chair, members of the committee, my name is Linda Newman. I'm representing the Missouri Association of School Nurses. The Missouri Association of School Nurses is in support of Senate Bill 841, especially the section that would modify the current statutes regarding epinephrine in schools. Food allergies can result in anaphylaxis, which is a life-threatening problem. Currently, the Missouri Public Schools, in Missouri Public Schools, there's more than 29,000 students at risk for anaphylactic reactions while at school. Anaphylaxis, again, is life-threatening, and some people are very hesitant to give an auto-injector. Not the nurses, we have no problem. But not all schools have school nurses, and some of those schools are in rural areas. I'm from St. Louis. We're most concerned about the rural areas, and that's why we'd like to see this language changed, because there is another alternative now that is FDA approved. It's been FDA approved for over a year now. Almost made to the finish line last year. Didn't quite get there on that Wednesday. So at any rate, there was language approved last year by both the Senate and the House, but it just needed that third and final read and pass. So at any rate, the alternative now is a nasal spray. As you know, there are several other medications that can be just up the nostril. Even if the kid has a cold, doesn't matter. It's temperature stable, within reason. You can't put it in boiling water or freeze it for lengths of time, but it is stable. It's been used for over a year now, and this language change would, to either epinephrine delivery devices, take out auto-injector, because that would include both forms, because some people may choose to keep the auto-injectors. There's also a program for each of those where schools can actually get that for free to stock. The stock law's been there for a long time. And so there's another one on the horizon that third quarter will be submitted to the FDA. That's the sublingual.
Thank you for your testimony. I appreciate it. Any questions for the witness?
Okay,
Seeing none, appreciate your time.
thank you.
Next in favor?
Thank you, Madam Chair. My name is Ryan DeBoof. I'm a registered lobbyist for Jordan Valley Health. We just wanted to go on the record with regard to support for the 340B language for FQHCs. Jordan Valley is a large FQHC in southwest Missouri. We provide much of the care and many of the pharmaceuticals covered by the 340B program in our area. Happy to answer any questions.
All right, thank you. Any questions? Thank you for your time.
Thank you.
Next in favor?
Madam Chairman, members of the committee, my name is Kaina Iman, and on behalf of the Missouri Nurses Association and Missouri Occupational Therapists Association, we'd like to go on record on several different provisions in the bill, which have already been addressed by my colleagues before me, but the epinephrine delivery services that our school nurses talked about, doula services reimbursement that Ms. Schlemeyer talked about, telemedicine that Mr. Alferman talked about, and then the workplace signage for assaulting a healthcare worker. We like all those provisions.
Right, thank you. Any questions? Seeing none, appreciate your time. Next in favor?
Madam Chair, members of the committee, I'm Dr. Samuel Corin. I'm a molecular pathologist representing the Missouri Society of Pathologists. Appreciate the chance to comment in support of the clinical pathology services provision of this bill. I'm a little bit out of my element in this white coat, but chose to wear it to highlight that pathologists are indeed doctors. We analyze samples from patients to diagnose cancer and ensure each lab result is accurate and meaningful. We ensure the processes and the personnel in the labs will provide quality results, and we review individual test results for any issues or concerns. We hold medical liability for each result provided from the lab. The provision addresses a gap in the Missouri Health Net policy to ensure pathologists are paid for all of the services we provide in hospital labs. Briefly, a review of the history of this. It was passed unanimously out of the House Professional Registration Committee last year. It also passed out of the Senate Committee on Health and Welfare as part of House Bill 1943, and it was included in Senator Bernsketter's Senate Bill 7 from last year, which is why it's part of this package. As you know, this year the language has so far passed out of the House Health and Mental Health Committee in House Bill 2372 with no opposition to our language. We are currently working on the House sponsor on that side of the building to refine our language, and we'll share those changes as soon as possible with the sponsor, his staff, and the committee, and I'm happy to answer any questions about it.
Great, thank you. Any questions? All right, thank you for your time. Next in favor? I know, I was like,
Madam Chair, members of the committee, Rob Monses with Missouri Hospital Association. We greatly appreciate Senator Bernskoetter bringing this forward. I include several provisions we support. I want to highlight the prior authorization provisions that are included in the bill. Essentially encompass what was passed by the House last year in House Bill 618 on a vote 164-4. And it was unanimously voted out of Senate Insurance and Banking last year. Did not have discussion on the floor, but we feel very good about its prospects. We appreciate the Senator including it in this important healthcare legislation. Happy to answer any question.
all right, Rob, thank you. Any questions? Seeing none. Next.
Madam Chair, Committee, Michael Henderson for the Consumer Healthcare Products Association in favor of the sections dealing with pseudoephedrine purchases. Thanks.
All right, thank you. Any questions?
Thank you.
Appreciate it. Next in favor?
Good morning, Madam Chairman and members of the committee. I'm Pamela Lanier. I'm here on behalf of Freeman Health System, speaking in favor, especially with regard to the prior authorization, introducing Vice President of Care Coordination and Post-Acute Care, Becky Beeler, who's here to express her personal and provide some personal testimony with regard to the importance of this prior authorization language.
Yes,
Is that on?
Just make sure the green button's on.
Okay. It's really an honor for me to be here. We deal with discharge planning and prior authorization daily at Freeman, and I just wanted to read a couple of examples of denials and delays and how they impact our patients. The first is about a patient who was admitted to Freeman in early December. 4 days into his stay, the physician recommended discharge to a long-term acute care hospital, or LTAC. Authorization from patient's insurance was requested on 12/24, but nothing was heard from insurance besides requests for more clinical information until 12/31, when a denial was issued by the insurance. An appeal was filed, and insurance finally provided authorization on January 7th. The patient was discharged to appropriate level of care, but had to endure a 21 unnecessary day length of stay. My second example is for a patient who was approved for a power wheelchair through her traditional Medicare. And prior to distribution of that wheelchair, she switched to a managed Medicare, which promptly denied it. Freeman's DME, or Durable Medical Equipment Provider Health Essentials, went through every appeal avenue possible, and after many months finally received an overturn of the denial through the Office of Medicare Hearing and Appeals. Despite this, the managed Medicare plan continued to deny the patient something she needed for safety at home. She had several falls. It resulted in hospitalization until she finally switched to another plan that would ultimately give her the equipment that she needed to be safe at home. And so we really see a lot of patients with unnecessary length of stays and not being discharged to an appropriate level of care.
I appreciate your testimony.
Thank you so much.
Thank you. Any questions for the witness? Seeing none, appreciate your
Thank
time.
you.
Thank you. Thanks for coming all the way up from Southwest Missouri. Appreciate it. Anyone else here to testify in favor?
Good morning, Madam Chair. So I wanted to start off with just a couple notes, and this is just from my own personal testimony. Oh, sorry. I'm usually on the other side. My name's Kiara Johnson. I'm just here for myself. So my grandmother was born with the help of a midwife in a time where care began in the community with faith, trusted support, and women who understood the needs of mothers. So when we talk about doulas and community-based maternal care, we are not introducing a new concept. We are formalizing a model that has proven record of improving outcomes. My perspective is both personal and policy-driven. I have served in a leadership reviewing Missouri's maternal and infant care health data through Missouri Health Net, examining how access, education, and continuity of care directly affect birth outcomes. The data is clear. When mothers have support before, during, and after delivery, we see reductions in complications, lower preterm birth rates, and healthier infants. This legislation strengthens that continuum of care. It allows doulas to be integrated into the care team. It improves system efficiency through community paramedicine, and it reduces non-emergent utilization of emergency departments, which is critical and as our hospitals operate under workforce and capacity constraints. It also enhances accountability in long-term care facilities, ensuring that our most vulnerable populations receive timely oversight, quality services, and the dignity they deserve. From a policy standpoint, this is about better care, coordination, smarter utilization of our existing workforce, and improved outcomes without duplicating services. From a human standpoint, it is about every Missouri family that has relied on the system in a moment of need. This is efficient, it is an outcome focused, and it reflects both our values and responsibilities. Thank you.
Thank you. Any questions? Appreciate it. Thank you for your testimony. Next in favor?
Madam Chair, members of the committee, my name is Matt Thompson, here to testify in favor of Senate Bill 841. Specifically two provisions, Cox Health, BJC Health, Rankin Jordan, Missouri Association of Rural Health Clinics, National Association of Social Workers, and Reach Healthcare are all here to testify on the prior authorization provisions of the bill. And BJC Health, Reach, National Association of Social Workers are supportive of the insurance coverage of alternatives to opioid provision. So,
Appreciate your
that'll take
testimony.
any questions.
Any questions? Seeing none. Appreciate your
Thank
time.
you.
Next in favor?
Madam Chair, members of the committee, Deanna Hemphill on behalf of Missouri State Medical Association. I don't have anything specific to note. We support the bill.
All right, thank you. Next in favor?
Thank you, Madam Chair, member of the committee, Megan Howerton here on behalf of the Missouri Ambulance Association in support of the bill, specifically for the provision that deals with the community paramedics. The provision updates the community paramedic law to allow for expansion of the use of community paramedics in the state. They provide non-emergency services to help provide health care to those who are frequent flyers to the emergency department. Community paramedics, their services make providing emergency health care more efficient, and they also save on costs for the patient, ambulance providers, and also the hospital. Thank you.
I have a question for you. I haven't read this section yet, and I will, but does this allow them to, what I was told from some of my paramedics is that their training is a lot more rigorous than they're allowed to perform out on the field. Does that deal with this at all?
I would have to get back to you on that question.
Okay, if you would, I'd appreciate it. Okay, thank you. Next in favor?
Chair, member of committee, members members of the committee. Henry Otalmach with the Missouri Pharmacy Association, RX Outreach, to go on record in favor of Senator Bernsketter's bill regarding two provisions. One is the RX Cares program. It allows the Board of Pharmacy to work with various pharmacy organizations or healthcare organizations to do grants for specific healthcare initiatives throughout the state. And the other is regarding Chapter 338.010, which updates the vaccine guidelines for pharmacists to allow them to immunize seniors who want to receive the RSV vaccine.
Okay, any questions? See none, appreciate your time. Next in favor?
Morning, Madam Chair and members of the committee. Chris Schroer here on behalf of a few clients. I'll first start with Nurture Kansas City, which is very supportive of the doula provisions that are in this bill and the important role they play with moms and babies, specifically in the Kansas City region, and a lot of the infant mortality issues that we see occur there. Also on behalf of the Missouri Association of Nurse Anesthetists, who are very supportive of the anesthesia time billing protection that we are in support with our colleagues in the anesthesiologist world. And then finally, on behalf of Golden Valley Medical Healthcare, the district and municipality hospital investment changes to mirror them with what you all passed several years ago for county hospitals. Very supportive of that provision in the bill. Happy to answer any questions.
All right, thank you for your time. Next in favor?
Madam Chair, members of the committee, Will Mars on behalf of Mercy Health Systems, just want to go on record in support, particularly on the prior authorization piece. So.
Appreciate it. Any questions? Seeing none? Appreciate your time. Next in favor? Going, gone? All right. Next in opposition. Moving to opposition.
Good morning, Madam Chairwoman. Hampton Williams with the Missouri Insurance Coalition. There are 5 provisions that we have concerns with, and generally speaking, this bill began almost as a bill dealing with administrative issues from SB7. It went over to the House, and then there were a lot of amendments put on to it. Many of the things that we have objections to deal with the House amendments that were placed on. First and foremost, the prior authorization language, which is page 74, lines 1 through page 80, line 17. The language that appears is from a House floor substitute. I will be happy to go into I don't have 2 minutes to go through all the issues with it, but I will just note that the versions filed by the sponsors this year are not the language that appear in the House floor substitute. There are drafting issues with it. For example, while there are limitations on pharmacy services, it uses terms like not to exceed the amount of $100,000, but it doesn't say what that applies to. So there's, in addition to the technical aspects of the bill, we also have broader concerns about the policy. The state of West Virginia last year actually removed the pharmaceutical coverage from this exemption to prior authorization because of excessive GLP-1 prescriptions. It cost the state plan $50 million by prescribing GLP-1s to folks that were not actually diagnosed with diabetes. And so what they did is they changed their prior authorization program, exemption program, to not allow for the coverage of pharmaceuticals. So we worked with sponsors last year to try to come to some compromise language. We're going to be happy to do that again. I think there's going to be a House hearing on the prior authorization tomorrow, and then I think there's one scheduled for early March for the Senate version as well. But the language as is, we have a lot of concerns with. The anesthesia time section, page 72 and 73, the definitions that I'm most concerned with is line 33, page 73, regarding payment of anesthesia services. It deals with the amount of money, not the total thing. I'll be happy to get this in a letter, submit it to the committee, and I appreciate your time. Happy to answer any questions.
That would be great. We'll be in contact with the senator, the bill sponsor, to make sure that, if there's any concerns that are ongoing, we might be able to help with that. So I'm sure the senator's happy to work with you. All right. Next in opposition.
Good
Madam Chair, Shannon Cooper today representing America's Health Insurance. It's great to be back here in an opposing fashion like normal, but I'll just kind of echo Hampton's testimony. A lot of things in this bill that we don't have any issues with whatsoever. There's 4 or 5 items that do create concern. Be happy to come share those with you as well as the sponsor and, let you know our concerns and the reason why. Be happy to answer any questions.
Any questions? Seeing none?
Thank you.
Next in opposition.
Thank you. Excuse me. Thank you, Madam Chair, members of the committee. David Willis here on behalf of the Missouri Health Plan Association. We're the association of Medicaid managed care companies that cover a large portion of the Medicaid population here in the state of Missouri. Really primarily testifying just against one provision of this bill, the prior authorization sections, or known as the gold carding sections, which is a mandate on our companies to provide waiver of prior authorization for providers that hit a 90% approval threshold over a prior period. That severely limits our ability to manage utilization of healthcare, which is one of the primary ways we control cost on behalf of the state. I've been testifying on this bill for a number of years now. We did an analysis over the last interim. If this bill had been effective over the prior year, what would that have cost in the state, in the state's Medicaid program? The fiscal note on the bill only contemplates the portion of the state employee plan. It doesn't contemplate Medicaid at all. If this bill was effective in 2025, it would have cost the state's Medicaid plan a minimum of $69 million, probably more like 90. And that's not factoring in any change in behavior by providers. That's just what would have happened looking backward. We anticipate, and what other states have seen, is if you pass a program like this, you end up with more utilization of healthcare services. I'll pause my testimony there. Happy to answer any questions or visit with anyone offline.
Are you, just one question, do you have you read the language coming over from the House on prior auth?
I have, yeah.
And are you more favorable to that?
Similar concerns. We do actually appreciate this bill contains a quality provision in it where lower quality hospitals in terms of outcomes have a slightly higher threshold, but it's only at 91 instead of 90. We think that threshold should be higher for providers that don't have as high a quality outcome metrics.
Okay, appreciate it. Go ahead, Senator Nicola.
Do you have the fiscal note data, a document that you mentioned?
Happy to provide that to you. Yeah, it's not. I mean, it's not done by the
Sure.
state.
No,
That's
I
done by
understand.
our side. Yeah.
Yeah, okay. Yeah, I'd like to see it. Thanks.
Sure.
All right, appreciate your testimony. Next in opposition.
Lisa Panett with Armorvine. I'm going to attempt to give you the most egregious portions of this bill because it's humongous. 190.098 is redefining really what paramedic services are. It's now going to be provided in a non-emergent setting, independent of a 911 system or emergency summons. So this is a substantial change that we're making in our healthcare system. And the second part I'm going to highlight is 192.021. DHSS is authorized to contract directly with an entity or a qualified vendor list composed of Missouri affiliates of national public health associations. So these were the Faucis of the world that some of us had an issue with during COVID. 208.1405, it defines the doulas in the bill. Doulas are also providing assistance by referring pregnant individuals to community-based networks and certified and licensed prenatal professionals in multiple disciplines. Will this be abortions? 208.1410, paying for doula services covered by Mo HealthNet. I'm going to say that Planned Parenthood shows on their website we have doulas for abortion, doulas for assisted suicide or death doulas, and doulas for transitioning for girls that want to be boys or boys that want to be girls. And lastly, I'll cover 338.710. The RX Cares program promoting medication safety is set to expire, and you are removing that sunset. Again, this is a huge omnibus bill. These are just some of the very few things that I'm highlighting that I find the most egregious, but overall, this needs to be gone through with a fine-tooth comb.
Thank you. Any questions for the witness? Seeing none. Appreciate your time. Next in opposition. Going, gone. Anyone here to testify for informational purposes? All right. Any closing comments, Senator?
No, thank you, Madam Chair, members of the committee. I'd be happy to work with the committee and anybody else to
All
see
right.
if we can't figure this all out.
I appreciate it. Thanks for your time. All right, that concludes the hearing for Senate Bill 841. We'll now move to Senator Crawford's bill, Senate Bill 1573. Senator Crawford, begin when you're ready.
Thank you, Madam Chair, members of the committee. For the record, Sandy Crawford, District 28. Thanks for the opportunity to present to you Senate Bill 1573. Senate Bill 1573 promotes a more stable transition from adulthood to adulthood for youths aging out of the foster care or custody of the Division of Youth Services. This bill will ensure if guardianship is going to be the permanency plan for youth as they age out of the foster care or state custody, the proposed guardians, including public administrators, are engaged in that transition planning process in those meetings at least 6 months leading up to the youth's exit. The bill also requires that youth leaving foster care be provided with essential records and additional guidance before they exit that care. Some of those records include information on how to access their medical records, how to obtain court and legal documents, a formal letter verifying prior foster care status, which is often required to qualify for different programs or benefits, and information on relevant social service programs, supports, and eligible pathways. Too many times our young people are leaving foster care and they don't have the correct paperwork and they don't know how to get it. And so this will help with that as they try to access housing assistance, education benefits, health care, or workforce supports. This provision ensures that they can enter into adulthood with the basic tools and documentation that they're entitled to, and it will create a more seamless transition by allowing public guardians to be identified and engaged earlier in that process when guardianship is anticipated. I'll be happy to answer questions, but I believe I have a couple of public administrators here who live with this every single day, and that's who asked me to put the bill forward. So I'm happy to answer questions, but I think I have a couple of experts behind me too.
Thank you, Senator Crawford. I just want to say that I've had the opportunity and the honor of working with some of my public administrators, and I'm telling you, these guys are the unsung heroes of the counties.
Totally agree.
I can't believe the amount of work that they do to try to take care of kids in our community that nobody else even knows about. So thank you for bringing this bill forward. I will go ahead and our first witness in favor, basically. Come on up.
Morning, Madam Chair.
Morning.
Members of the committee. My name is Timothy Weeks. I am the St. Louis County Public Administrator. First off, I want to thank you all for having us here today, and I want to thank Senator Crawford for her work on this bill as well. And thank you, Madam Chair, for your comments as well. I really appreciate the fact that public administrators are becoming recognized throughout the state of Missouri for the work that we do throughout the state. So thank you for that. I'm here to ask you to support Bill 1573 because it helps solve an essential problem that we've dealt with for a long time. And unfortunately, over the last decade, it has increased for public administrators where we are getting appointed for younger and younger individuals who are aging out of Children's Division care. Just last week, I had 3 cases that were filed as emergency petitions in St. Louis County Circuit Court because the youth are aging out of the system and nobody was paying attention early enough in the process to realize, hey, we need to get a petition on file a little sooner. And so I just want to give you guys a little background to let you know, my office handles over 500 individual cases, over 700 cases overall. Public administrators throughout the state of Missouri handle thousands of cases. I think at last count it was 11,000 or 12,000. what this does is provide for a more seamless transition to help these youth, not only public administrators, but the wards we serve, to make sure that they are provided the services that they need, that they are, that any benefits that to which they're entitled, that those are applied for, that those are discovered in time to help provide them housing and services to help them be productive human beings. And so public administrators work to preserve the dignity of each of these individuals, and this bill will help us do just that. So among the things that we need to know, we need the essential documents. We need to know relationships between family members, why the individuals came into care. We need all of that in order to provide for them and serve them as guardian. So thank you.
I appreciate your time. Any questions for the witness? Seeing none, thank you for everything you do. Really, truly, 24/7 calls, all of that. I believe, and you might be able to speak to this, I believe that there's a bill about basically the abuse that you guys sometimes encounter.
Correct.
Is there a piece of legislation?
Yes,
or
Madam
stuff
Chair.
that you're aware of?
Yes, Madam Chair. We are hoping that that bill will eventually see the light of day and be referred to a committee. There is a lot of angst towards public administrators who are appointed guardians over individuals, and we don't ask for these appointments. We don't seek these appointments. So, surprise, surprise, a lot of these wards, unfortunately, are not happy, and their family members. But we are appointed by the court, and sometimes that comes with dangerous territory, and we face verbal abuse and often, sometimes physical abuse as well.
Well, and in cases where like you're saying, these are adults that have disabilities and things like that. In particular, I'm very concerned about them, and so I appreciate it.
Thank you, Madam Chair.
Yep. Next in favor?
Madam Chairman, members of the committee, my name is Sam Madsen. I'm the Barry County Public Administrator. Senator Crawford has done a wonderful job crafting some language to help us out. I hold in my hand the motion for service on my latest case that I received on January 30th, 2026, with about 2 weeks head's notice on this gentleman. Received no documentation as to what his prior diagnoses were. The attorney spoke in court that she only received the notice that this person was going to be permanency planned towards guardianship 6 months prior. We came to find out during that hearing that this gentleman had been in care for over 6.5 years, and at any time during that first 6 years, they could have come to us and gotten us involved. What I have learned in my short tenure is that we need these documents. I asked in 2022 for my local circuit to start getting me involved 6 months prior, just like Senator Crawford's bill asks. These are the types of documents that we need as public administrators to make informed decisions for these people. And when we only receive this much documentation, it doesn't help us make informed decisions for those people. And so, like my colleague said, we would like to get in on the ground floor, learn about them, because we want them to be well taken care of. They are our most vulnerable population in the state. And so we have a rough job, and I appreciate your comments, but we really do appreciate Senator Crawford for putting this bill forward.
No, I appreciate your time. Any questions for the witness? How many cases do you handle?
Currently, my caseload runs around 110 actual people with about 160 cases total on my docket.
So in Jasper County, I asked my PAs what their caseload was, and they said 450.
Yep.
So and that's 24/7
Yep.
calls in the middle of the night and stuff.
And
so.
Newton County runs pretty close to that as well.
Yeah. No, thank you for your time. Appreciate it.
Thank you.
Next in favor?
Good morning, Madam Chair and members of the committee. My name is Madison Ekrit, and I'm here on behalf of Foster Adopt Connect, a statewide nonprofit that helps to support recruit potential foster families, support foster families and adoptive families as well. And we are here in support of this bill. We worked with the public administrators and Senator Crawford's office to help craft it. This provides essential information, not only for all foster youth that are being transitioned out of foster care, but also specifically for those who have guardianship as their next permanency plan. In particular, some of this information is needed for those next level of services because they're individually managed. So people will need their records, proof that they were in foster care to be able to access certain levels of benefits that are status driven. And so this just helps that transition process.
All right, appreciate your testimony. Any questions? Seeing none, appreciate your time. Thank you. Next in favor? Okay, gone. Anyone here? Oh, one more.
I got stuck behind a very slow driver, so I was a little bit late.
You're fine.
Ended up on the wrong floor. I thought I walked into the first floor, but I wasn't. My name is Elisa Breitenbach, and I live in Independence, Missouri. And last time I was up here, I actually testified with James Talent in front of Claire McCaskill. You know, this bill I support, but it is so shameful. This is so shameful. And why is it so shameful? Because foster children, they have nothing. They literally have nothing. And foster care in America is the greatest betrayal of justice in America to children and families. Their statistics are startling. It's startling that this is what we have to fight for this. We have to beg for something like this, that you even had to work on this. It should have already been happening. The case for foster care reform has been written in stone. So many children have been killed. Of course, it's been found less abusive to put children with their relatives, but for some reason that doesn't happen. Children are more likely to die in foster care and have been found to be 42% likely to die than children in the general population. Missouri takes children into foster care at a rate higher than our national average and houses them in hospitals, hotels, offices. They send them out of state even. Kids stay in foster care longer than federal standards even want them to here in the state of Missouri. Teenage pregnancy rates are nearly 1 in 3 young ladies become pregnant, and young men, it's nearly half of them become fathers before age 21. Only around 68% of these children have a high school education when they leave our state foster care system. And only 30%, and 30% of them literally leave with nothing. Roughly only 44% of them are employed, and by age 21, only 56% of them are employed. Missouri is known as the foster care to prison pipeline. More than 90% of our youth in foster care with 5 or more moves become involved in the justice system. These children are more likely to have PTSD than veterans of war and less likely to be able to recover from this PTSD. I want to thank you for actually putting something in writing for these kids, but this is unforgivable. I just recently retired from being a foster mom, and I could not believe how difficult it was. I would never be able to do it again. In fact, my heart went into heart failure because it was so extremely hard. The paperwork is outrageous. They run you around like a crazy person. I loved my foster kids. This is so sad what happens in our state. And to top it all off, believe it or not, I lost my children in 1984, and they were lost for 10 of the longest years of my life to the foster care system because of a false allegation. And even though I proved my innocence, and even though the facts were clearly out there, I never got to see my children for 10 years. I even hired the state Speaker of the House went Winters in Kansas to represent me to adopt my own child out of foster care. These are horrendous things. And my son afterwards finally jumped out of a 4-story building and ran back to my home after 10 long years. I got him back, and it was the toughest thing I could have ever imagined. It was awful. He was so full of hate and anger, and I did not blame him, not one little bit. These children are tortured. They are literally tortured, and they lose everything, their families, their toys, their schools, everything. And this is the best we can do? This is the best? I'm not buying it. But I thank you for putting that in writing, because my children and my foster children deserve much better than this from our state. Thank you.
Thank you for your testimony. Any questions for the witness? Go ahead, Senator Nicola.
I want to thank you for taking your time today to come and share your story with us. And the stats that you mentioned are horrific, and there's a lot of work to do in the foster care system. Just a little bit of knowledge I have and some of the things that I've seen, there's just a lot of work.
They have no voice.
Yeah.
They have no voice.
Yeah.
And they need voices. They need more than this.
Yeah.
And they need voices, and they need support. And they don't deserve what happens to them. Not one of them deserve what happens to them.
Yeah.
Thank you,
Well, thank you. Thank you for being here. Thank you, Senator, for this legislation too. Appreciate it.
Any closing, anyone here to testify in favor? We'll close that up. Anyone here to testify in opposition? Thank you. Anyone here for informational purposes only? Thank you. Senator, any closing comments?
No, I appreciate the opportunity.
Thank you. All right, that concludes the hearing for Senate Bill 1573. We now will go to Senate Bill, we have 3 bills being heard at once. Senate Bill 1275, 1086, and 1489, and then we'll present the bill together.
And just as a reminder for anybody testifying on this bill, make sure you fill out a separate witness form for each specific bill that you're testifying. So if you're doing 1086, just do one for 1086. If you're doing one for all 3, do one for each separate bill. Thank you.
Madam Chair, my best friend, Senator Carla May, is running my Committee on Judiciary. So once I'm answering questions and done, if I can jump back up there.
Of course, yeah.
I know
We'll
it's in
put it to
capable
your
hands.
colleagues and let them, we were in your committee earlier, so I appreciate the expediency in which you let us here have our bills heard. Go ahead, when you're ready.
Oh, that's all right.
Okay.
Here we go.
Thank you, Madam Chair, members of the committee, or member of the committee. Senator Nick Schroer, for the record, Senate District 2, presenting Senate Bill 1275. I believe all 3 of these bills are identical. This bill is about health care, access, medical autonomy, and trust in informed adults. This bill would allow ivermectin tablets and hydroxychloroquine tablets to be purchased over the counter, giving patients greater control of their own health decisions in consultation and pharmacists and healthcare professionals. Ivermectin and hydroxychloroquine are long-standing FDA-approved medications with decades of clinical use and well-documented safety profiles. First, with ivermectin, discovered in 1975, it has been used globally for more than 30 years to treat parasitic infections. It received a Nobel Peace Prize and is on the World Health Organization's list of essential medications. It has been distributed widely in international public health campaigns and has been credited with dramatically reducing parasitic disease burden. Hydroxychloroquine, since the 1950s, has also been used safely for decades and is commonly prescribed for malaria, rheumatoid arthritis, lupus, and more. These medications are not experimental whatsoever. They are not new. They are not untested. They are familiar to physicians, pharmacists, and patients alike. These bills do not force anyone to take these medications. It does not override physician guidance. It simply removes an unnecessary barrier to access for medications with long-standing records. We trust adults to follow labeling instructions on many other over-the-counter drugs that can have serious implications if you do not follow the instructions, and charge them to consult with pharmacists and their providers when necessary. The same principle applies here. Allowing over-the-counter access, we empower pharmacists, physicians, and patients alike to serve as accessible healthcare touchpoints, particularly in rural or underserved areas where physician access may be limited. And with that, I'll turn it over to my colleagues.
Thank you, Madam Chair and the committee, for hearing our bills here this morning. For the record, I'm Senator Joe Nicola, representing District 11, which is the northeast corner of Jackson County. As my colleague Senator Schroer just mentioned, how safe this ivermectin and hydroxychloroquine really are. I have a few other comments to add to that. We had a doctor that was unable to come today, but he did make this statement. It's Dr. Ryan Cole. He also testified in Tennessee a few years ago, and he said this, speaking specifically of ivermectin, as a medication, it is safer than aspirin or Tylenol, which both cause thousands of deaths per year. Ivermectin was only associated with a few over 40 years' time, and those were not proven to be causative. It is toxicologically the second safest drug on earth. It is on the top 10 list of the World Health Organization in terms of essential medicines. It has a 21 plus known mechanisms of action, having antiviral, antiparasitic, and anti-cancer properties. It has been safely taken by billions of doses in Africa for almost 40 years. And of course, it won a Nobel Prize. Recently, that was the doctor's quote. This is me now recently reporting, says the National Cancer Institute is looking at ivermectin in preclinical cancer research. The National Cancer Institute lists at least one clinical trial involving ivermectin. However, this does not mean ivermectin is a proven treatment for cancer. Last year, the state of Florida set aside $60 million for research on the effectiveness of cancer. As my colleague mentioned, ivermectin's been on the market for 45 years. It's sold in feed stores. It comes in a caulk-like tube in a paste, and many people are taking it. They're trying to figure out how to dose it for individuals. This bill, our bills, would make this for human use in tablet form, specifically for doses for humans. So people don't have to take it, by a paste and go to a feed store to get it. So those are just a couple things that I wanted to mention about the bills, and I'll turn it over to my colleague.
Thank you, Madam Chair and committee member Nuremberg. Thank you for being here. Senator Nicola, you're on the committee also, but you've got the bill. State Senator Curtis, Gregory, District 21, mine is 1489. This is something that obviously we saw in the news for many years, and it's something I've taken an interest in. Have many friends that have started taking it on their own through various sources, and like has been mentioned, you can go to different ag retail stores and get it and self-dose and self-administer. And the one that piqued my interest the most is he said, I started taking it, and a week or two later, my knees quit hurting. And obviously, it's well known that I've got knee problems, so I'm definitely interested in it. My story for really getting behind it and filing it is a lady from our church approached me sometime last fall and asked if this was something that I could file and carry. So I'm not going to mention any of that, but just for the people that didn't hear, I'll read some of the. She wasn't able to be here today. She's a teacher back in Marshall, but did send some letter. My name is Diana Failer, a lifelong Missouri resident who has been diagnosed with breast cancer 3 times in the last 20 years. Receiving my latest diagnosis in February of 2023, I now have stage 4 metastasized estrogen-positive breast cancer with a gene mutation, eventually become resistant to every treatment option currently offered. That is your opening paragraph. Since my cancer was diagnosed near the end of COVID, ivermectin was almost impossible to find in human-grade form. And if you could find it online, there was no guarantee what quality drug you would be buying. It's also worth mentioning that a drug that should be very inexpensive is overly expensive for the average person in order to receive the recommended dosage for fighting cancer. In order to affordably obtain ivermectin, I had to locate a feed store, purchase ivermectin intended for livestock animals, then calculate the appropriate human dosage. And then she goes on in closing. Now, alongside with anecdotal studies, researchers are conducting scientific studies to prove if ivermectin can work with other cancer treatments to reverse its progression. However, those of us who are in stage 4 do not have the luxury of waiting years to benefit from the results of scientific studies. We need the chance to try drugs like ivermectin, mebendazole, that's not included in our legislation, and hydroxychloroquine at affordable costs. If these drugs are made available over the counter, they will come with a list of side effects and possible interactions, just like any other over-the-counter drugs with side effects. We consumers can read and assess the risk of taking them. And my personal experience as a stage 4 cancer patient, the benefits far outweigh the risks because despite all the odds, I am still living. And I would not have been able to tell you that at any point in time, I noticed that, sometimes you can just tell looks like she's doing very well and very thankful for that. So I provided a copy of that letter to the committee chair to hopefully distribute to the rest of the committee.
We'll make sure that gets distributed. So
And Madam Chair, real quick, I forgot to say, I'm currently on ivermectin. I was sick over the weekend. The doctor that prescribed, I'm sorry. He's scooting back. You can see my nose is raw from sneezing and blowing my nose all weekend. Nothing seemed to touch it.
Watch your colleagues start to slide
right.
away.
Well, the doctor that prescribed it was going to be here today, and I can get her statement to the committee. She had a slew of patients that she couldn't leave today.
No, I appreciate that. Apple flavor from the feed store?
Well, no, it's not.
No.
I don't have it from the feed store. This is actual 10 pills were about $90, and this would drastically drop the costs if people can have this over the counter.
Oh, that's great. So, Curtis, is it apple flavor?
I have no idea. Kind of the running joke in the agriculture community when COVID was going on is we were still obviously doing our work is we never caught COVID because obviously when you're liquid drenching livestock, you're going to get some ivermectin on you. So that was kind of just the running joke in the agricultural community.
No, it was a joke.
It
On
happens.
our
It
farm
gets
also.
it gets sprayed a little bit.
I appreciate you bringing the bill forward. It's something that I think a conversation that needs to happen, and so I appreciate that and your efforts to get it passed. Do you have any questions? Senator Nuremberg?
I know. You all are probably not surprised that I have questions. Thank you.
Never.
Good morning, gentlemen. Or senators. I'm sorry. That's the first time I've slipped on that in a while.
No
Good
gentlemen
morning,
in the Senate.
senators. Sorry about that. Thanks for the conversation this morning. Let's start with Senator Gregory. You have an emergency clause on your legislation. The other two senators do not. Why is an emergency clause needed?
Honestly, I probably don't know how that was added or drafted. I wouldn't say that it's needed there can be a conversation had around that one. I think that the main thing would be if we're going to go in that sphere is to make sure people can get access to it quicker. As my constituent mentioned, she credits this sole treatment to the reason why she is doing well and improving her condition. And like she said, I'm still alive despite all the odds.
I believe you mentioned that there would still be a whole host of warnings that would correspond. For example, ivermectin, one of the side effects can be severe nervous system damage by overdosing, taking too much, etc. And so one of the things that, let me back up a little bit. First of all, and again, not a doctor, not a pharmacist, but when I was doing some research on this, just recently the FDA did come out sharing that ivermectin is not authorized or approved to treat COVID-19. And in fact, the clinical data now does not demonstrate that ivermectin is effective against the virus. So that's the latest from the FDA. So why the FDA obviously has approved these drugs for limited cases today. Where are they going in terms of expanding? Do you all know in terms of reclassifying these drugs? Is there a push to make them over the counter? Where does that stand? And why can't we wait for the science to pan out in terms of those studies?
I think that's a very good question. I think if they were smart, they would be looking into it. At the end of the day, though, I think sometimes I definitely sit back and question when you look at the pharmaceutical industry that if you can go repurpose a drug to take care of an issue, because we have all sorts of compounds out there that are already known that we know it works here, but maybe it works here. I sometimes question, are we actually trying to... My question always comes up with cancer because it's definitely affected my family. Both my grandmothers have died from breast cancer. You always wonder, are we actually trying to find a cure, or are we just trying to find something to keep making money? Obviously, we're a capitalistic society and I have nothing against that whatsoever. But I wonder, are we doing right by people for that? You have this treatment here that I would say doesn't have the nasty effects of what chemotherapy and or radiation does. My father regrets putting his mother through chemotherapy treatment in her 70s or 80s because of what it did to her. Her quality of life at the end was absolutely horrible. And I think this is a way that we can look at, maybe it's not going to absolutely prevent it, but the quality of life and maybe it does shrink it is way better than putting someone through chemotherapy. And I know those technologies are getting better. University of Missouri, the studies they're doing with their MER reactor now to develop treatments that go for liver cancer that go straight to the liver to attack the cancer instead of going through your entire body is absolutely impressive. And I think we're going to get there at some point in time. But along the ways, if there are drugs that can be repurposed that are a lot cheaper, then why are we not looking at that?
And Senator, I think this is kind of consistent with what the people of Missouri have done. We didn't wait to legalize medical marijuana, recreational marijuana. We didn't wait for the feds to reclassify. And this is similar. Pursuant to the 10th Amendment, it's our duty to work on a lot of these issues that have not been specifically given over to the feds. And when you look at all of the warnings and labeling that would be on these drugs, just like you have with cough and cold medicine, Sudafed, sleep aids, NSAIDs, pain relief, like Advil, Tylenol, anti-diarrheal, caffeine pills, those can all be abused as well. So we trust people to make the right decision, to read the labels. If they have any issues that pop up, to consult their physician. And this would be no different.
Thank you for that question, Senator. I think it's a great question, too. And I agree with my colleagues on this. This drug, in particular ivermectin, but both of them have been on the market for a long time. I've taken both. I've taken hydroxychloroquine quite often over probably a period of almost 30 years, off and on for various reasons. People are already doing this. They're going to feed stores, they're getting the paste, and they're trying to figure out what the right dosage is. Many people, the testimonies are they're having success with this for a variety of reasons. I agree with Senator Schroer saying we didn't wait on certain things. The FDA doesn't approve certain homeopathic things, certain organic type things or natural products that many people are taking and having great success with. And since this has already been on the market, it's proven. The doctors are even saying it's safer than aspirin and Tylenol. Let the free market work. Let the people let them choose. This isn't going to force a pharmacy to sell it. They can choose to sell it or not sell it. It's not going to force people. And just like you go buy anything from the store, any kind of medication, it has the warnings on it that it could do this, could do that, and it's just personal responsibility too, without waiting for the FDA to do any type of approval. They have approved it already for parasitic use, so it's not like they're not approving it whatsoever. So anyway, I think I appreciate the question. It's a great one.
Thank you.
All right, that concludes the hearing. If you have any other comments, we're going to go ahead and pivot, let Senator Schroer leave, but anybody here to testify in favor, we'll begin with testimony.
Lisa Panett with Armorvine, and we really appreciate all three of the bills. And as someone who had to walk way too many people during COVID down the road to get some help and some relief, we saw that the hospitals were not doing this. I saw people that died because the hospitals would not, and they would not give them any sort of alternative. And the doctors that would and put their license on the line, they were the ones that actually saw all the patients improve. We didn't see any that didn't improve almost immediately. So we appreciate all three of the senators bringing this.
Thank you.
Yeah.
Next in favor? Anyone else here to testify in favor? Okay, gone. Anyone here to testify in opposition?
You're not allowed to come.
Chair, and
It's
the
not too
committee.
late.
I know. I talked to the senators yesterday, and as always, we will work with them. Henry Salmach here on behalf of the Missouri Pharmacy Association, go on record in opposition to senators' bills. The senators have brought up various points that I will not articulate to on the personal reasons for this. For pharmacy in particular, in 2022, I wish Senator Bratton was here. We worked with him and Senator Onder on a compromise similar to this bill in Chapter 338.055, which in Section 7 that states that the Board of Pharmacy and the Board of Pharmacy cannot deny or revoke the license of a pharmacist that dispenses this medication that is prescribed, right? If a physician prescribed it, the pharmacist still has to be able to dispense it without any repercussions on their license. And it was a similar bill that Senator Onder and Senator Bratton had sponsored at that time. In 4 other states, Tennessee, Louisiana, Texas, and senators, I'm missing one, is it Arkansas or Arizona? It's Arkansas. Arkansas, they've all passed this where they've made this medication OTC. So it's over the counter. A patient can purchase it. What is happening, and unless I've misinterpreted what's being said by the other states, pharmacists have two options. They can carry the medication but can still not dispense it, cannot make it over the counter because of the FDA guidelines, or they're not carrying it because their concern is their overall licenses may be lost if they sell this medication over the counter. The FDA regulates all medications, right? Unless it's supplements, which these aren't supplements, they're manufactured. And for that reason, the FDA overall has the ability to classify what it is for. So ivermectin, it is for parasitic issues, as Senator Nicola has said, and hydroxychloroquine is for lupus and malaria, as Senator Schroer has said. A healthcare provider has to follow FDA guidelines. There's no way about that, around that. You have to have a prescription in order to get these medications, and a pharmacist that sells it over the counter would be violating those federal guidelines and regulations, which then puts their licenses at risk. And so that's why we're up here in opposition. We'll always work with the senators on a compromise if they want us to. I know it's personal for them, so we'll be glad to work with them.
So did the bill that you passed with Senator Onder not take care of your concern?
So it did. This was Senator Bratton, Senator Onder. It was an omnibus health care bill where at that point in time during COVID, there were physicians that were prescribing both medications, and what happened was pharmacists were concerned that if they dispensed the medications without any protections, they would lose their license. And Section 7 solved that issue, so pharmacists could dispense it, and they were, right, more readily than they originally were. So it solved the issue on the prescriptive aspect, but it still doesn't make it OTC because, again, we have to follow federal guidelines on medications.
Okay, appreciate your testimony. Nope. I have no further questions, sir.
Perfect.
You're free to go. Anyone else here to testify in opposition? All right, senators, we'll wrap it up. Any closing comments?
Thank you for your time, Madam
All right.
Chair.
Okay. All right, we're going to stand at ease for just a minute till we get our quorum back. With quorum being established, I now make the motion that we adjourn. Can I get a second? All right. The Committee on Family, Seniors, and Health is now adjourned.